As we age, our bodies change and the way we take care of them changes too. For seniors over the age of 65, mental and spiritual health is just as important as physical health, and convenience matters too. Dr. Gavin Mckinnon is with CenterWell Senior Primary Care Senior Focused Care Facilities. Good morning.
Good morning, Deborah.
All right, first I want to address there's a name change. CenterWell used to be Partners in Primary Care, but you still got the same great care.
Yeah, that's right. We changed our name from Partners in Primary Care to CenterWell Senior Primary Care earlier this year, and we're a network of one-stop doctors' offices throughout the greater Houston area. We have 12 locations.
And the nice thing about this is that this is health and wellness, which they're related, but a couple of different meanings to them, all encompassing body, mind, and spirit.
Yeah, exactly. I think it's really important to recognize that, seniors' health needs are very specialized, and that body, mind, and spiritual health all are interrelated. So we try to take a holistic approach in that regard.
We know that for a lot of our seniors, a lot of things can become overwhelming. Just getting out of the house, for example, and just going to a doctor's appointment. So sometimes they'll put it off out of inconvenience, but you try to make it as convenient as possible, starting with shorter wait times.
Yeah, so our offices are sort of built. We are a senior-focused primary care office, and so we're built around seniors' needs. So that starts with shorter wait times, like you mentioned, but also longer visits with your doctor. And also, we offer on-site labs and even an activity center here, where seniors from the community can come in, do activities like arts and crafts, bingo, silver sneakers, things of that nature.
Yeah, and in those longer doctor visits, it's oftentimes when you discover something else that a lot of people might not think of, but is so related to overall health, including things like saying that they're lonely, or they might be struggling financially, which adds a lot of stress, or food insecurity. You can help them connect to solving those issues.
Absolutely, and that's precisely why we take a team-based approach. So each one of our clinics is led by a board-certified physician, but we also have clinical pharmacists, social workers, behavioral health specialists, and some of our sites have nurse practitioners and physician assistants as well.
Yeah, you have 12 locations. You thought of everything, even inside each office. Certain things that might be more conducive to your patients, your seniors coming in, floors that are easy to negotiate, bigger scales, things like that you took into account as well.
Yeah, absolutely. We really try to accommodate everybody's needs because the needs of seniors are so very specialized.
Yeah, you're taking new Medicare Advantage patients, which is another thing that's good for people to hear, because sometimes you'll hear, no, sorry, not taking any new patients, but new Medicare Advantage patients.
Yeah, 100%. We're all accepting new patients, and I think that's one of the things that's so difficult that I hear from so many of my patients is that it's really hard for them to get into their previous provider, and so all of our locations right now are accepting new patients.
Yeah, Dr. Mckinnon, a lot of us have a tendency to go to the doctor when we think something is wrong, but you would like to see us before so you can head off some things. So especially for someone who's 65 plus, how often should they come in for a yearly exam? Or should it just be yearly or more, is what I should say?
Yeah, so it's like the old adage: an ounce of prevention is worth a pound of cure, and so especially ages over 65 should at least be seen once a year. But here at CenterWell, we like to see our patients at least every 3 months, just to currently check in on things, because oftentimes getting ahead of issues and is really the best approach.
Yeah, a lot of people put off those visits because of COVID. Some still have some concerns, even if they may have been vaccinated. So you do have video visits that are available as well, and socially distant in-person appointments for sure?
Yeah, absolutely. We're all doing video visits so that seniors can participate with their electronic devices. We also can meet via telephone, and in the office we're taking precautions, social distancing, mask wearing, and those things of that nature to make everyone feel safe and comfortable.
Yeah. Speaking of electronic devices, nice recovery on getting that camera right back on. You didn't skip a beat. Let me wrap up with, there's all kinds of things that you can do in medicine. Why is this particular area something that you decided to take part in?
Yeah, I think that there's so many reasons, but primary care speaks a lot to me because I get to develop relationships with my patients and get to see the outcomes, develop over time. And really, what it comes down to is I appreciate the one-on-one individual relationships that I have with folks, and seniors are very special to me. So,
Yeah, and we're all going to get there hopefully someday. All right, thank you very much, Dr. McKinnon.
thanks so much for having me.
And for more information about CenterWell Senior Primary Care or to find a location nearest you, visit seniorfocusedhouston.com, seniorfocusedhouston.com, or call this number 832-558-3859, 832-558-3859.